If you're over 60, there's a quiet danger hiding in plain sight inside exam rooms and hospitals, and almost no one warns you about it. For years, we've been taught that more medical tests mean better protection, better prevention, and longer life. But what if some of the most common health tests ordered for seniors are actually increasing the risk of harm instead of reducing it? What if a test you trust, one your doctor casually recommends, could lead to unnecessary procedures, lifelong complications, or serious stress your body never needed to endure? Here's the uncomfortable truth. Aging bodies do not respond to medical tests the same way younger bodies do. After 60, and especially after 70, changes in metabolism, kidney function, bone strength, and recovery ability mean that even routine tests can trigger a chain reaction of problems. A single scan can lead to another scan. A small finding can lead to a biopsy. A precaution can quietly turn into a procedure. And suddenly, a senior who felt fine is navigating pain, anxiety, or complications that never had to happen. This is exactly why many experienced doctors, especially those who treat older adults every day, privately avoid certain tests for themselves as they age. Not because they reject medicine, not because they don't believe in science, but because they understand something most patients are never told. The balance between benefit and harm changes with age. And when that balance tips the wrong way, testing can hurt more than it helps. What makes this even more troubling is that these tests are still widely recommended out of habit, outdated guidelines, fear of missing something, or pressure from the healthcare system. Seniors often assume, if my doctor ordered it, it must be necessary. But medicine is not one size fits all, especially later in life. And blindly following every test recommendation without understanding the risks can quietly steal independence, peace of mind, and quality of life. In this video, we're going to talk about 5 very common health tests that can be risky for seniors when used routinely. Tests that sound responsible on the surface, but may do more harm than good after a certain age. This is not about avoiding care, it's not about fear, it's about protecting your body, asking the right questions, and making informed decisions that truly support healthy aging. Because the most dangerous test isn't always the one that finds something wrong, it's the one that starts a medical journey you never needed to take. And here's where it gets even more worrying. Before we go any further, let me gently say this. If staying informed, protecting your health, and making smarter medical decisions as you age truly matters to you, please take a moment to like this video and subscribe to the channel. It helps more seniors find calm, trustworthy health guidance like this. And it allows us to continue sharing information that supports independence, confidence, and safer aging for everyone. To understand why certain health tests can quietly become dangerous later in life, we first need to talk about what actually changes inside the body as we age, because these changes are real, measurable, and well documented in medical research. As we get older, nearly every system involved in medical testing works differently. According to research from the National Institute on Aging, kidney function naturally declines with age, even in healthy seniors. This matters because many common tests use contrast dyes or medications that must be filtered through the kidneys. Large clinical studies show that older adults are significantly more vulnerable to contrast-induced kidney injury, especially after imaging tests like CT scans or cardiac studies. What a 40-year-old body clears easily can overwhelm a 70-year-old body without warning. At the same time, healing and recovery slow down. Peer-reviewed studies published in journals like JAMA and the BMJ show that seniors experience higher complication rates after invasive follow-up procedures, such as biopsies, scopes, or catheter-based tests, even when those procedures are labeled routine. The body simply has less reserve. This means that a test result that leads to further intervention can trigger pain, bleeding, infection, or long recovery periods that deeply affect quality of life. Another major issue is false positives, and this is one of the least discussed dangers for older adults. Large population studies involving tens of thousands of seniors have found that as we age, Screening tests are more likely to detect abnormalities that look concerning but will never cause symptoms or shorten life. According to research referenced by Harvard Medical School, these harmless findings increase sharply after age 60. Yet once they're found, they often lead to more tests, procedures, and treatments, none of which improve longevity, but many of which increase harm. There's also the problem of overdiagnosis. The U.S. Preventive Services Task Force and similar bodies in the UK, Canada, and Australia consistently note that many conditions found through routine screening in older adults grow so slowly that they would never cause illness. However, once diagnosed, they are often treated aggressively. Studies show this can lead to unnecessary surgeries, medications with serious side effects, and long-term stress, all without extending life expectancy. Perhaps most importantly, research from the NIH and Cleveland Clinic shows that for many routine tests, the overall survival benefit drops significantly after a certain age, while the risk of harm continues to rise. This doesn't mean testing is bad. It means testing must be personalized, not automatic. And this is where the real danger quietly begins. Because once a test is ordered, most seniors are never told how quickly it can set off a chain reaction they never needed in the first place. One of the most concerning tests for older adults, especially when done just to be safe, is the full-body CT scan. These scans are often marketed as a powerful way to detect disease early, offering peace of mind and reassurance. But for seniors, medical research tells a very different story. First, let's talk about radiation exposure, because this is not a small issue. According to data from the U.S. Food and Drug Administration and studies published in major radiology journals, a single full-body CT scan can expose the body to radiation levels equal to several hundred chest X-rays. Large population studies show that cumulative radiation exposure increases the risk of DNA damage over time, and older adults are more vulnerable because their tissues repair damage more slowly. This doesn't mean one scan guarantees harm, but it does mean unnecessary scans should be avoided. The second major risk is something called incidental findings. Research from Harvard Medical School and the National Institutes of Health shows that full-body CT scans in asymptomatic adults frequently detect small spots, nodules, or irregularities that look suspicious but are actually harmless. In seniors, these incidental findings are extremely common. Studies estimate that over half of older adults undergoing full-body imaging will have at least one abnormality flagged, most of which will never cause symptoms or shorten life. But once these findings appear in a report, they rarely get ignored. According to peer-reviewed research in the New England Journal of Medicine, incidental findings often lead to repeat scans, invasive biopsies, or surgical procedures. For seniors, these follow-up steps carry real risks: bleeding, infection, organ injury, and prolonged recovery. What started as a preventive scan can quickly turn into months of medical appointments, anxiety, and physical stress. A third concern is that large studies show no clear survival benefit from full-body CT scans in healthy, symptom-free adults, including seniors. Organizations such as the NIH and American College of Radiology emphasize that screening imaging should be targeted, not broad. When scans are ordered without symptoms or strong medical indication, the harms often outweigh the benefits in older populations. A safer, smarter approach is symptom-based and risk-based imaging. When a senior has specific symptoms, a strong family history, or a clearly elevated risk, targeted imaging can be life-saving. But scanning the entire body, just in case, exposes seniors to risks they may never need to take. Most seniors are never told how much radiation this single test actually delivers, or how often it quietly leads to procedures that were never truly necessary. For decades, the PSA blood test has been promoted as a simple way to detect prostate cancer early. Many older men continue getting this test every year without a second thought, often believing that stopping it would be irresponsible. But modern medical evidence paints a much more cautious picture, especially for men over 60 and beyond. First, it's important to understand what the PSA test actually measures. PSA levels naturally rise with age, even in healthy men. According to large studies reviewed by the National Institutes of Health and published in JAMA, elevated PSA levels in older men are far more likely to reflect benign prostate enlargement or inflammation rather than aggressive cancer. This means the test becomes less specific as men age, increasing the chance of false alarms. Second, there is the serious problem of overdiagnosis. Research summarized by the U.S. Preventive Services Task Force shows that a significant percentage of prostate cancers detected through routine PSA screening in older men are slow-growing and would never cause symptoms or shorten life. Large population studies involving hundreds of thousands of men found that treating these low-risk cancers does not significantly reduce overall mortality in older age groups, but it does increase harm. Those harms are not minor. Clinical studies from Harvard Medical School and the Cleveland Clinic show that prostate biopsies and treatments can lead to infections, bleeding, urinary incontinence, erectile dysfunction, and long-term quality of life issues. For seniors, recovery is often slower and complications can be more severe. What's especially troubling is that these side effects can occur even when the cancer itself would never have caused a problem. Third, medical guidelines have evolved, but many patients aren't told. Both the USPSTF and international health authorities emphasize that routine PSA screening should be based on age, overall health, and life expectancy, not done automatically year after year. Studies show that in older men with other health conditions, PSA screening rarely improves longevity, but frequently leads to unnecessary procedures. This doesn't mean PSA testing should never be done. It means it should be individualized. For some men with strong family history or specific risk factors, it may still make sense. But for many seniors, especially those without symptoms, the risks often outweigh the benefits. This test finds something in many men, but that doesn't mean it should always be chased or treated. For many seniors, colonoscopy has been framed as a lifelong obligation, something you must continue no matter your age. It's often described as a gold standard test that saves lives, and in younger adults, that's largely true. But as people age, the balance between benefit and risk changes in ways that are rarely explained clearly. One of the biggest concerns for older adults is procedure-related risk. According to large studies cited by the Centers for Disease Control and Prevention and published in Gastroenterology, seniors face higher rates of complications from colonoscopy, including bowel perforation and bleeding. These risks increase significantly after age 70, and even more so in adults with heart disease, diabetes, or kidney problems. What is often described as a safe, routine procedure can become physically stressful for an aging body. Another overlooked risk is the bowel preparation required before the test. Research from the National Institutes of Health shows that the intense laxative preparation can cause dehydration, electrolyte imbalances, dizziness, and even falls in older adults. For seniors, especially those living alone, this prep phase can be more dangerous than the procedure itself. Hospitalization related to bowel prep complications is well documented in older age groups. The third issue is diminishing benefit. The U.S. Preventive Services Task Force and similar agencies in the UK, Canada, and Australia note that routine colonoscopy offers little survival benefit beyond certain ages, particularly for seniors who have had previous normal screenings. Large population studies show that colorectal cancers detected late in life often grow slowly, meaning they are unlikely to affect lifespan, but detecting them can still lead to surgery, chemotherapy, and long recovery periods that reduce quality of life. Importantly, modern guidelines now emphasize individualized screening decisions. This means considering age, overall health, prior test results, and personal risk, not simply repeating colonoscopies out of habit. For many seniors, safer alternatives such as stool-based tests can provide useful information without the risks of sedation and invasive procedures. This is where doctors quietly change recommendations, but patients are rarely told why. Bone density scans, often called DEXA scans, are commonly used to assess osteoporosis risk. Many seniors are told they need these scans regularly to protect against fractures. While DEXA scans themselves are low in radiation and generally safe, the problem isn't the scan. It's how often it's done and what happens afterward. Medical research from the National Institutes of Health and large osteoporosis studies shows that bone density changes very slowly, especially in older adults. In fact, multiple peer-reviewed studies published in journals like Annals of Internal Medicine found that repeating DEXA scans more frequently than every 2 to 5 years rarely provides new or useful information. For many seniors with stable bone density, frequent testing offers no added benefit, but it can trigger unnecessary concern. Another major issue is overtreatment. According to research reviewed by Harvard Medical School, borderline or mildly reduced bone density in older adults often leads to long-term prescription of osteoporosis medications. While these drugs can be helpful for some high-risk individuals, large studies show they also carry risks, including digestive problems, muscle pain, rare jawbone complications, and atypical thigh fractures. Seniors placed on these medications due to minor scan changes may face more harm than protection. There's also the problem of false reassurance. Studies from the Cleveland Clinic indicate that some seniors with normal DEXA results may still be at high risk for falls and fractures due to muscle weakness, balance issues, or vision problems, factors a bone scan cannot measure. Relying too heavily on repeat scans can distract from what actually prevents fractures in older age. Medical guidelines now emphasize a smarter approach, longer intervals between scans combined with real-world prevention strategies. Research consistently shows that strength training, balance exercises, adequate protein, vitamin D when appropriate, and fall prevention measures reduce fracture risk more effectively than frequent scanning alone. The scan itself isn't dangerous, but what often comes next can be. Heart disease is a serious concern as we age, so it's understandable that many seniors are offered cardiac stress tests or advanced heart imaging just to check. These tests sound reassuring, but when done in seniors without symptoms, medical evidence shows they can create more problems than protection. One major issue is the high rate of false positive results. According to large cardiology studies published in JAMA and reviewed by the Cleveland Clinic, stress tests in asymptomatic older adults frequently suggest heart disease that isn't actually causing harm. Aging hearts naturally show changes that can appear abnormal on imaging or exercise testing, even when blood flow is adequate. These misleading results often trigger further testing, not because the heart is failing, but because the test created uncertainty. That uncertainty often leads to invasive follow-up procedures. Research from the National Institutes of Health shows that abnormal stress tests commonly result in cardiac catheterization, or CT coronary angiography. For seniors, these procedures carry real risks, including bleeding, vascular injury, stroke, and reactions to contrast dye. Kidney injury from contrast is especially common in older adults, even those with previously normal kidney function. Another important finding comes from large population studies examining outcomes. According to research summarized by the American College of Cardiology, routine stress testing in symptom-free seniors does not significantly reduce heart attack rates or extend life compared to careful monitoring and risk factor management. However, it does increase exposure to radiation, procedures, and hospitalizations, all of which can reduce quality of life. Modern cardiology guidelines now emphasize symptom-based evaluation. This means testing is most valuable when a senior has chest pain, shortness of breath, unexplained fatigue, or clear changes in physical ability. For those without symptoms, evidence shows the safest and most effective approach is managing blood pressure, cholesterol, blood sugar, staying physically active, and avoiding smoking. Many seniors end up in the hospital not because of heart disease, but because they were chasing a test result that never needed to be chased. At this point, you might be feeling a mix of concern and relief. Concern about how easily unnecessary testing can happen, and relief knowing there is a safer, more empowered way forward. The good news is this: Seniors who actively participate in medical decisions consistently experience fewer complications and better quality of life, according to medical research. One of the most powerful tools you have is simply asking the right questions. Studies on shared decision-making published by the National Institutes of Health show that when older adults ask why a test is needed, what problem it will change, and what happens if they choose not to do it right now, unnecessary testing drops significantly, without worsening outcomes. This doesn't mean challenging your doctor in a confrontational way. It means partnering with them. Another key factor is understanding risk versus benefit in the context of age and overall health. Research from Harvard Medical School emphasizes that a test should only be done if the potential benefit clearly outweighs the potential harm for you personally. For seniors with multiple chronic conditions, large studies show that reducing unnecessary testing often leads to fewer hospital visits, fewer medication side effects, and less medical stress, without increasing mortality. Bringing a trusted family member or friend to appointments can also make a measurable difference. According to patient safety studies published in the BMJ, seniors who have a second set of ears present are more likely to understand test risks, remember options, and avoid rushed decisions. This support reduces anxiety and helps ensure that choices align with personal values and long-term goals. Finally, focusing on what truly protects health is essential. Evidence from long-term population studies consistently shows that lifestyle measures, such as staying physically active, maintaining muscle strength, eating adequate protein, managing blood pressure, and preventing falls, have a greater impact on independence and longevity than most routine screening tests in older age. You don't protect your health by saying yes to every test. You protect it by making informed, thoughtful decisions that respect your body, your time, and your quality of life. And that's where real safety and confidence begin. If there's one message I want you to carry with you after watching this video, it's this. Getting older does not mean giving up good medical care. It means choosing smarter, more personalized care. Tests are tools, not obligations. And the safest medicine is the kind that fits you, not just a checklist. Medical research from organizations like the NIH, Mayo Clinic, and WHO consistently shows that seniors who avoid unnecessary testing often experience less stress, fewer complications, and better day-to-day well-being. This isn't about fear or avoidance. It's about understanding that protecting your health sometimes means knowing when not to test, and when to pause and ask thoughtful questions. Aging well is about preserving strength, independence, clarity, and peace of mind. And those goals are supported far more by informed decisions, supportive healthcare relationships, and daily habits than by chasing every possible test result. When you understand the risks and benefits, you take back control, and that alone can bring a deep sense of relief. Remember, the best doctors don't just order tests. They listen, they individualize, and they help you make choices that support the life you want to live. You deserve that level of care at every age. And here's the surprising part almost nobody tells you. The most powerful health decision you can make as a senior is not about what you do next, but what you thoughtfully choose to avoid.